Kidney failure can be life-threatening when symptoms go unnoticed. I never would have connected my dry skin and metallic taste in my mouth to kidney problems. By the time I was diagnosed, my kidneys were functioning at just 15%, shared my patient Ellen after her shocking diagnosis at age 52. Tragically, Ellen's story isn't unique. Every day, people ignore their body's warning signals until it's almost too late. In this video, I'll break down all 12 silent signs your kidneys could be failing, including the 3 most commonly misdiagnosed ones. Recognizing these symptoms early could mean the difference between effective treatment and kidney failure. Meet Sarah. At 52, she was chalking up her constant exhaustion to simply getting older. Despite adequate sleep, she found herself struggling to make it through her workday, often needing to rest after climbing a single flight of stairs. When her doctor finally ran some tests, the diagnosis was shocking. Her kidneys were functioning at only 30% of normal capacity. Sarah felt bewildered and frustrated, wondering how this could have happened without her noticing sooner. Healthy kidneys produce erythropoietin, EPO, a hormone that signals your bone marrow to create red blood cells that carry oxygen throughout your body. When kidneys begin to fail, EPO production drops, reducing red blood cell count and leading to anemia. This creates an energy deficit at the cellular level, like a car running on fumes instead of a full tank of gas. Your tissues receive insufficient oxygen, forcing your heart to work harder while you feel drained. Research published in the American Journal of Kidney Disease found that fatigue often appears as the earliest symptom of kidney disease, sometimes years before diagnosis. Patients frequently attribute their exhaustion to aging, stress, poor sleep, or depression, while their kidney function deteriorates undetected. Kidney-related anemia produces fatigue that persists regardless of how much you sleep and typically worsens throughout the day. Simple tasks like preparing a meal suddenly feel exhausting. If you're experiencing unexplained, persistent fatigue, talk to your doctor about checking your kidney function. A simple blood test can measure both kidney function and detect anemia before severe damage occurs. While blood tests can reveal internal issues, your body often displays visible warning signs you can't ignore. Consider Robert's experience. When his favorite shoes suddenly felt tight and his ankles appeared swollen, he immediately blamed his new blood pressure medication. But during a routine checkup, his doctor discovered something far more concerning. His kidneys were failing to remove excess fluid from his body. Healthy kidneys serve as your body's sophisticated filtration system, maintaining precise fluid balance by removing excess water and sodium from your bloodstream. When kidneys begin to falter, this delicate filtering mechanism breaks down. Without proper filtration, fluid accumulates in your tissues like a water balloon, gradually filling, creating visible swelling doctors call edema. This pooling of fluid follows a predictable pattern, typically starting in the lower extremities. Gravity pulls excess fluid downward, making ankles and feet the first casualties of this distinctive balloon effect. As kidney function continues to decline, the swelling often progresses upward, eventually reaching the hands and sometimes even the face. Many patients notice this swelling worsens throughout the day. Your shoes might fit in the morning but feel painfully tight by evening. The PIT test helps determine if you should consult your doctor. Press firmly on swollen tissue for a few seconds, then release. If the indentation remains briefly before slowly filling back in, it's time to ask for kidney function tests. Beyond cosmetic concerns, this fluid accumulation creates dangerous effects throughout your body. The extra fluid volume increases workload on your heart, potentially leading to high blood pressure, enlarged heart chambers, and eventually heart failure if left untreated. That excess fluid from your failing kidneys doesn't just swell your ankles, It can literally drown your lungs from the inside. This silent infiltration is why Karen couldn't catch her breath after climbing a single flight of stairs. She'd been using her asthma inhaler more frequently, assuming her respiratory condition was worsening with age. Her doctor, however, discovered something far more alarming. Her kidneys were functioning at just 25% capacity, and fluid was accumulating in her lungs. When your kidneys are healthy, they maintain a delicate fluid balance throughout your body. As kidney function deteriorates, this balance becomes impossible to maintain. Excess fluid seeps into your lung tissue like water slowly filling a sponge, collecting in the tiny air sacs where oxygen exchange occurs. This condition, pulmonary edema, creates a physical barrier between the air you breathe and your bloodstream. For Karen, the diagnosis was terrifying. "I thought I was just getting old," she confided. "I never imagined my kidneys were causing my breathing problems." The progression is subtle but dangerous. Initially, you might notice being more winded when walking upstairs. As kidney function declines, breathing difficulties intensify until even minimal activity becomes challenging. Many patients can no longer lie flat in bed, a condition called orthopnea, because fluid shifts when they recline, intensifying the suffocation sensation. This respiratory distress combines fluid infiltrating your lungs, while anemia reduces your blood's oxygen-carrying capacity. These symptoms are frequently misdiagnosed as asthma, COPD, or age-related decline, delaying crucial kidney function tests. Misdiagnosis isn't limited to respiratory symptoms. Your body has another way of signaling kidney distress that occurs in private, through your urine output. What many dismiss as simply not drinking enough water could actually be your kidneys desperately trying to tell you they're shutting down. John's story illustrates this hidden danger perfectly. At 64, he noticed he was producing less urine despite maintaining his normal fluid intake. "I figured I was just sweating more during summer," he told me. 6 months later, a routine blood test revealed severe kidney damage that had been silently progressing. Healthy kidneys are remarkable filtration systems, producing approximately 1 to 2 quarts of urine daily. This consistent output helps maintain proper fluid balance while removing waste products from your bloodstream. A significant decrease below 1 quart should raise immediate concerns. Failing kidneys create a dangerous paradox in your bathroom habits. Your overall urine production typically decreases during the day as filtration capacity diminishes. Yet simultaneously, many patients experience increased nighttime urination because damaged kidneys can no longer concentrate urine properly, forcing bathroom trips precisely when you should be sleeping. By the time you detect a significant decrease in urine output, your kidneys may already be functioning at only 25% of their normal capacity, a staggering 75% loss before this warning sign becomes obvious. Beyond quantity, monitor quality. Kidney damage often manifests through changes in urine appearance, darker, foamier, or containing traces of blood. If you notice any consistent changes in your urine output or appearance, consult your doctor immediately. These changes are your body's desperate attempt to alert you to the problem. Those visual changes in your urine represent just one way your body communicates distress. But there's another warning sign that feels far more immediate. Maria had been battling persistent nausea for months, despite eliminating various foods from her diet. It wasn't until comprehensive blood tests revealed her kidneys were failing that the true culprit emerged, a revelation that transformed her understanding of what her body had been trying to tell her. Healthy kidneys perform the crucial task of filtering waste products from your bloodstream. When this filtering system begins to fail, your body becomes like a home with clogged plumbing. Toxic waste backs up everywhere. This condition, uremia, occurs when waste products like urea accumulate to dangerous levels, directly irritating your stomach lining and triggering the brain's vomiting center. Kidney-related nausea has a distinctive connection to your diet. Your queasiness intensifies after protein-rich meals because protein foods produce more nitrogenous waste that damaged kidneys struggle to eliminate. That steak dinner that once brought satisfaction now leaves you feeling ill for hours as your compromised kidneys strain to process the additional waste. The progression follows a troubling pattern. Occasional morning queasiness gradually transforms into persistent discomfort throughout the day. As kidney function declines, this nausea escalates to vomiting that no over-the-counter medication can effectively address. Many patients endure months being treated for acid reflux, food allergies, or irritable bowel syndrome, while the underlying kidney damage remains undiagnosed. Doctors prescribe antacids, recommend elimination diets, or suggest stress management techniques, all while the real problem worsens in silence. The silent transformation of appetite goes beyond mere nausea. While other digestive symptoms prompt patients to seek immediate relief, this particular warning sign develops so gradually that most people attribute it to something else entirely. That's exactly what happened to David, who dismissed his 15-pound weight loss as simply a response to workplace stress. When kidney function deteriorates, waste products that should be filtered out instead circulate throughout your bloodstream, reaching your brain's appetite control centers. These toxins interfere with your natural hunger signals, like dimming a light until the room goes dark, fundamentally altering how your brain perceives hunger. The biological mechanism works as sabotage from within, suppressing your drive to eat when your body needs nutrition most. What makes this warning sign particularly insidious is how it affects taste perception. Many kidney patients describe food suddenly developing metallic edges or bitter undertones. This sensory distortion stems directly from toxins altering taste receptors. The hormonal system compounds these issues. As kidney function declines, leptin levels often increase abnormally. This hormone signals fullness, but excess amounts create a dangerous deception. You feel satisfied after just a few bites while your body desperately needs more nutrition. This creates a harmful downward spiral. Decreased appetite leads to poor nutrition, further stressing compromised kidneys. The weakened kidneys filter less effectively, allowing more toxins to circulate, which further suppresses appetite, accelerating kidney decline. If you've noticed persistent appetite changes with unexplained weight loss, especially with altered food tastes, don't attribute these to stress or aging. These symptoms, particularly when developing gradually over months, warrant kidney function assessment. That comprehensive kidney assessment might reveal more than the cause of your appetite changes. It might explain your deteriorating mental clarity. When our kidneys fail, they stop filtering physical waste and stop protecting our most precious organ, our brain. Consider what happened to Professor James. During his lectures, he began pausing mid-sentence, searching for common words that had suddenly vanished from his mental grasp. A sense of confusion and fear washed over him as calculation errors appeared in his work, something completely out of character for this meticulous academic. Like many of us would, he blamed these cognitive hiccups on mounting work pressure. The real culprit, however, was hiding in his bloodstream. Healthy kidneys act as vigilant guardians, filtering out compounds that become dangerous neurotoxins. When kidney function declines, toxins like urea and creatinine circulate freely in your bloodstream. These compounds can cross the blood-brain barrier, essentially acting like unwanted intruders, infiltrating the control center of your entire body. Kidney-related cognitive symptoms follow a concerning pattern. It begins with subtle concentration difficulties, perhaps rereading the same paragraph several times. As kidney function worsens, memory lapses emerge, confusion during routine tasks develops, and personality shifts occur that loved ones notice before you do. What makes this decline particularly insidious is its variability. These symptoms often fluctuate throughout the day. You might feel mentally sharp in the morning, but struggle with coherent thoughts by evening, especially when other kidney symptoms intensify. Research shows up to 60% of kidney disease patients experience cognitive dysfunction, often mistaken for early signs of dementia rather than recognized as kidney-related issues. Those unexplained muscle cramps waking you in the middle of the night might be more than just the aftermath of yesterday's activity. For retired athlete Michael, the increasingly severe leg cramps he experienced seemed like a natural consequence of his sports career. Yet when the pain became unbearable, medical tests revealed something far more concerning. His kidneys were failing to maintain the delicate electrolyte balance his muscles depended on. Your kidneys function as precise regulators of critical electrolytes like potassium, calcium, and phosphorus, minerals that control the electrical signals governing muscle contraction and relaxation. When kidney function deteriorates, this system falls into disarray. Much like a home's electrical system experiencing power surges during a storm, your muscles receive erratic signals that trigger painful contractions. What makes kidney-related muscle cramps distinctive is their timing. These painful spasms often strike during periods of rest, especially at night. You might also notice muscle twitching or weakness, signs that your muscle's electrical signaling system has gone awry. As kidney function declines, electrolyte disturbances intensify. The cramps become more painful, frequent, and resistant to remedies. Stretching provides little relief, and increased hydration barely helps because the underlying problem isn't dehydration, it's your kidney's inability to regulate essential minerals. The mechanism involves phosphorus levels rising in the bloodstream, causing calcium to be drawn from bones, while potassium imbalances interfere with muscle cell electrical activity. Statistics reveal approximately 40% of patients with chronic kidney disease experience these muscle cramps, a silent signal that your kidneys may be quietly failing long before other symptoms appear. While muscle cramps might signal internal electrolyte imbalances, your skin could be revealing something even more concerning about your kidney health. Did you know that up to 50% of chronic kidney disease patients experience intense, unrelenting itching that no moisturizer can soothe? This isn't ordinary dry skin. It's a direct manifestation of your body's toxic burden becoming visible. Diane's story illustrates this perfectly. At 58, she endured 2 years of severe itching that prevented sleep, leaving her arms and legs covered in scratch marks. Despite spending hundreds on premium moisturizers, antihistamines, and seeing 3 dermatologists, relief eluded her. Only when her annual physical revealed elevated creatinine levels did a nephrologist connect her symptoms to failing kidneys. Healthy kidneys efficiently filter waste from your bloodstream. When kidney function declines, waste products, particularly phosphorus and uramic toxins, accumulate in the bloodstream and deposit directly in the skin. This buildup triggers nerve fibers to send constant itching signals to the brain, like a fire alarm that never shuts off, urgently signaling something is wrong. Kidney-related itching has distinctive characteristics. It intensifies at night, disrupts sleep, and creates a generalized all-over sensation rather than affecting specific spots. The skin undergoes visible transformation, becoming increasingly dry and flaky, with a yellowish or grayish discoloration as toxins accumulate. Each scratch damages your skin's protective barrier, creating micro-injuries that allow more toxins to accumulate. This creates a vicious cycle where scratching provides momentary relief but ultimately worsens the condition, driving many patients to scratch until they bleed. That vicious cycle of itching and skin damage we just discussed has a dangerous parallel in another system of your body. If you're taking multiple blood pressure medications but your numbers remain stubbornly high, your kidneys might be both the victim and the culprit. This represents resistant hypertension, a warning signal that something serious is happening beneath the surface. Let me tell you about Tom. Despite faithfully taking 3 different blood pressure medications, his numbers consistently hovered around 170/95. Tom felt increasingly frustrated and worried as his primary doctor kept adjusting dosages and adding new medications with no improvement. It wasn't until he was referred to a nephrologist that the true picture emerged. His kidneys were caught in a destructive feedback loop with his blood pressure. Healthy kidneys regulate blood pressure through hormones and fluid balance. When kidney damage occurs, these regulatory mechanisms break down. The damaged kidneys produce substances that constrict blood vessels rather than dilate them, directly raising blood pressure. This elevated pressure then damages the delicate filtering vessels within the kidneys, creating a dangerous cycle that perpetuates itself. Kidney-related hypertension shows a distinctive pattern. It often fluctuates dramatically, with particularly high readings in the morning. Standard treatments frequently fail to control it, and patients take an increasing number of medications with diminishing returns. This pattern serves as a significant warning sign that's frequently missed. Over 80% of advanced kidney disease patients have hypertension, yet many medical providers treat it as essential hypertension without investigating kidney function. The blood pressure remains elevated because the underlying kidney problem goes unaddressed. While hypertension sends silent signals through your cardiovascular system, your taste buds might be delivering equally important messages about your kidney health. Have you ever experienced a strange metallic taste that no amount of brushing or mouthwash seems to eliminate? This isn't just an annoying sensation. It's a direct chemical communication from your kidneys that something is seriously wrong. Like an alarm bell ringing when your body's filtering system is in distress. When Lisa first noticed a persistent metallic flavor in her mouth, she assumed it was temporary. For months, food became increasingly unpalatable as everything tasted metallic. Only when her physician ordered comprehensive blood work did she discover the true source. Her kidneys were functioning at less than 40% capacity, allowing uremic compounds to accumulate in her bloodstream. This symptom directly signals compromised kidney function. When kidneys operate normally, they efficiently filter waste compounds from your blood. As kidney function deteriorates, these waste products remain in circulation, eventually finding their way into your saliva. The result is that distinctive metallic taste that approximately 60% of chronic kidney disease patients report experiencing. The same compounds responsible for the metallic taste affect your breath as well. Many patients develop halitosis with a distinctive ammonia or urine-like odor when these waste products are exhaled through the lungs, your body's alternative route for eliminating toxins when kidneys fail. Most concerning is how frequently this symptom leads to misdiagnosis. By the time this metallic taste appears, kidney function has typically declined to less than 50% of normal, a critical threshold where intervention becomes increasingly urgent. There's something deeply concerning about those middle-of-the-night trips to the bathroom that most people simply attribute to aging or prostate issues. While these explanations often seem logical, they sometimes mask a more serious underlying condition. Just ask George, who at 62 dismissed his 3 to 4 nightly bathroom trips as merely an enlarged prostate. His frustration mounted as sleep deprivation took its toll until his urologist uncovered the real culprit. His kidneys had lost their ability to properly concentrate urine. In healthy individuals, the kidneys perform a remarkable function during sleep. They concentrate urine, reducing nighttime production and allowing for uninterrupted rest. This is why most people can sleep through the night without needing to urinate. However, when kidneys begin to fail, they lose this vital concentrating ability, producing larger volumes of more dilute urine throughout the night. The paradox of this condition is particularly puzzling. Patients experience increased nighttime urination even while their overall daily urine output decreases. This contradiction occurs because failing kidneys can't respond normally to regulatory hormones that should reduce nighttime urine production. This kidney dysfunction directly explains why nocturia, having to urinate 2 or more times per night, is associated with a 40% increased risk of chronic kidney disease. Yet many patients receive treatments for prostate enlargement or overactive bladder, while the underlying kidney problem remains unaddressed. If you've recently developed or noticed worsening nocturia, particularly with changes in urine appearance or other symptoms we've discussed, request kidney function testing from your healthcare provider. Now that we've explored these 12 warning signs, let me emphasize something crucial. Early detection of kidney issues can truly be life-saving. Medical research shows that catching kidney disease in its initial stages dramatically improves outcomes. If you've recognized 2 or more symptoms, don't wait. Schedule an appointment with your doctor and request kidney function testing, the eGFR, creatinine levels, and albumin to creatinine ratio. These simple tests can quickly assess your kidney health. Early intervention can reverse damage through straightforward treatments like managing blood pressure, adjusting medications, and dietary changes. The difference between discovering issues at 70% versus 30% function could mean simple lifestyle modifications instead of lifelong dialysis. Remember, your body communicates with you. These signals are your kidneys asking for help.